So number one, 50% of children with ADHD will have some of their symptoms persist into adult life. And adult ADHD can lead to risky behavior, inappropriate sexual relationships, and antisocial behavior. Number two, 20% of ADHD adolescents show serious signs of depression when they get to their teen years. And number three, ADD and ADHD teens are 2 times as likely to smoke, 12 times more likely to use drugs and alcohol. Number four, ADD and ADHD adolescents are 4 times more likely to be involved in a fatal car accident, as compared to adolescents without ADD and ADHD. For obvious reasons. If they're not focusing while they drive, it's going to increase their percentage chance of having a car accident. Number five is after 1 year, 80% of ADHD children are no longer taking their medications. And that's typically because most of them find them not effective or not effective for the long haul. And the last one I'd like to go over is the yearly cost to maintain an ADHD child is $15,000 per year out of pocket. So there's some pretty startling statistics, and reason enough to try to get this thing under control to really improve your child's future. Now, brain-based therapy is a really unique way to treat these problems. It's designed to maximize each child's brain by providing specific stimulations to the areas that are weak, to the areas where your child needs it. So for example, we can use light as a stimulation. We can use sound as a stimulation. We can use inner ear, or what's called vestibular or cerebellar stimulation. We can do gross motor stimulation or fine motor stimulation, or we can use balance therapy. These are all things that we can do, and I'm going to be going over these as we go further along on this video specifically. So basically we use specific stimulations that the brain can perceive, the body can perceive, and we aim that at the areas of the brain that are weak, whether it be the left or the right side or a certain aspect of one of the sides of the brain. And we do that so those areas can change, so those areas can improve and they can become stronger. We can also use different types of cognitive exercises. We can do problem-solving exercises. We can do creative analytical exercises. Then, of course, there is nutrition and metabolic testing. Remember, the brain needs 2 things to survive. The brain needs fuel, and the brain needs activation. Activation are the stimulations that the brain needs. But it doesn't just need stimulation. Again, it needs fuel, and fuel comes from the foods that we eat, and it comes from our nutrition, and it comes from our metabolism, and it comes from our oxygen, the oxygen that we breathe. So in our office, with the kids that come into our office, we want to do specific types of metabolic testing. We want to look at blood sugar. We want to see if your child has dysglycemia. A lot of these kids have problems with insulin resistance, or they have hypo or reactive hypoglycemia. We want to look for nutritional deficiencies. We want to look for fatty acid imbalances. We want to look at the adrenal glands. The adrenal glands sit right on top of the kidneys, and a lot of these kids have troubles with their adrenal glands. So we want to do what's called an adrenal stress indices. We also want to look for food sensitivities. We want to look for gluten sensitivities, red dye sensitivities, soy yeast sensitivities. So we do testing for that. We send them out for different types of panels. We also want to look at the gut. We want to look at how your child's digestive tract is functioning. A lot of kids with these types of problems have digestive disturbances. We want to look and see if they have dysbiosis. Do they have improper amounts of healthy bacteria? Do they have what's called a leaky gut syndrome? And a leaky gut syndrome leads to food sensitivity. So we want to really look at everything. There's so many things we need to look at if we're going to do a good job. If we're going to do a comprehensive job at determining what's causing your child's problem so they can get better. So we want to leave no stone unturned in finding out why your child has the problem. So the whole point is to turn on your child's brain. Now you can think of your child's brain as a solar-powered calculator. Okay, if it's a great example. If you take a solar-powered calculator and you take it out of the light, it's going to have no stimulation and it's not going to charge. You're not going to be able to use it. But if you take a solar-powered calculator, you put it back into the light, you get it back stimulated, what happens? Well, the battery charges. That's exactly what we want to do with your child's brain, only we want to do it without drugs. We want to do it with fuel and activation, specific types of stimulations, so your child can get better. Now the other thing is we want to aim that at the areas that need it. So we want to be specific. We don't want to just have the child do a bunch of sensory activities that hit every part of the brain. No, we want to find out what areas are weak, and we want to aim our stimulations at those areas. So that's very important. We want to be specific. So basically what we want to do is we want to turn on the brain. We want to get the brain functioning the way it was intended to. Okay, treatment-wise. Well, treatments, brain-based treatments, are going to depend upon which part of the brain we find needs to be stimulated, which lobes of the brain, which sides of the brain, and that's based on the examination, which I'm going to be talking about here in just a minute. Now with ADHD and most of these types of problems like ADHD, most of the time, 95% of the time or better, it's the right side of the brain that needs to be stimulated. So when we're treating children, there's really two aspects of the treatment. The first aspect is the fuel side, and the second side is the stimulations. Now, of course, the brain needs fuel and activation. So fuel is making sure that any food sensitivities are gone, and we talked about this. Making sure that we make any dietary changes, nutritional supplements. We work with various companies that we do nutritional counseling and nutritional supplements, such as fish oil and different things that get blood sugars in order. So that's all based on the metabolic testing. The other thing is the stimulations. The stimulations are geared to improve the activation of the brain, improve what we call the neuroplasticity, which means that that side of the brain is becoming more efficient, it's developing better neurotransmitters, better nerve growth, better synapses, and that's what we're trying to do with these stimulations. So for example, we can use the cerebellum to get at and stimulate the brain. Now the cerebellum is the back part of the brain. It's right in through here, and there's a left lobe and a right lobe of the cerebellum. Cerebellum controls balance, it controls coordination, it controls all of your spinal postural muscles, and so we can stimulate the left cerebellum because the left cerebellum fires to the right brain, and the right cerebellum fires to the left brain. So cerebellar stimulations are things like balance exercises, standing on one leg, walking on a balance board, catching a ball while you're walking on a balance board, doing vibration. Vibration stimulates the cerebellum, so we can have your child standing on a vibration platform or a platform that moves. We can do stability exercises or use a stability ball, one of those like exercise balls that you see in a gym. We can use that because that stimulates the cerebellum. We can stimulate the inner ear because the inner ear fires right into the cerebellum, which then eventually will fire to the brain. So we can do head tilts, or we can do head rotations, or we can do some caloric stimulation. So these are some of the things we can do to stimulate the cerebellum. The other thing we can do is visual stimulation, visual exercises. We can have your child wear these eye lights. These are eye light glasses, and basically what will happen, as you'll see here in just a second, see the flashing lights. What will happen is we can cause the lights to flash in a certain hemisphere of the visual field. So the left hemisphere of the left visual field will fire to the right brain. And so they can wear these glasses. They look kind of interesting when you wear them. But what happens is they stimulate certain sides of the brain. We can do this while they're walking on a balance beam. So we can combine therapies. We can do certain types of visual tracking exercises, slow tracking, fast tracking. We can use what's called an OPK tape, which actually is obviously a red and white striped tape, but as we move it, it will cause the eyes to develop a bouncing, or they'll actually be stimulated, and what that does is it creates stimulation of a certain side of the brain. We can use our Hemistim program, which is kind of similar to the OPK tape. We can use visual discrimination exercises, which basically, there's many different types, but here's an example of one. When you look at the large letter, here, large letters that you see here, inside here are a smaller letter. So if we ask your child the large letter, and we go through the whole alphabet here, that's going to go over the large picture, and it's going to stimulate the right brain. Because remember, the right brain is the big picture. If they look at the small letters, that's going to be left brain. Okay, so that's an important thing.